host, Danielle Renckly, and welcome to A Virtual View. Whether this is your first time joining us or you're a longtime listener, I'm excited to have you here. So, this is the start of our 5th season of A Virtual View, my 3rd as the host, and I'm really looking forward to all of the great conversations I know we're going to have in 2026. And for January, we have a really interesting one lined up. January is Cervical Cancer Awareness Month, and to learn more about the current state of cancer in the region and what treatment and prevention options look like through telehealth, I spoke with Mary Robertson and Calvin Roberson from the Office of Community Outreach and Engagement at the IU Comprehensive Cancer Center. We started out with the basics. What is a snapshot of the current state of cancer right now?
Well, if you look at Indiana as a whole for the past couple of decades, cancer has been either the number 2 or the number 1 mortality, one or two in terms of causing death and mortality here in the state of Indiana. And so it is a big issue that affects a lot of Hoosiers all across the state.
That's Calvin Roberson, the Operations Director for the Office of Community Affairs and Engagement. When I asked Mary Robertson, the prevention and screening lead, if she had anything to say about cancer outside of Indiana and the UMTRC region, she had this to say.
So overall, it depends really on the specific cancer type. In Indiana, we do tend to have higher rates of most cancers than the United States. And so as a whole, but again, that differs depending on what specific cancer you're looking at.
While we talked, Calvin wanted to make it clear that a diagnosis of cancer isn't necessarily a death sentence.
And then some of the cancers are either preventable or you get to detect them early so that people can survive and thrive. And so, our main thrust is to focus on those cancers where the science has indicated, hey, if you detect it early and you get it treated, you can have a good quality of life. So your breast cancer, your colorectal cancer, your lung cancer, and HPV-related cancers, you can either detect them early or with HPV vaccination, you can prevent it. And so getting the information out to the public provides an opportunity of hope. It provides an opportunity where people can know, hey, if I do X, Y, and Z, I can minimize the occurrence of something happening, or if something does happen, death is not the outcome. And I think when people hear cancer, that's the first thing they hear is a death sentence. But there's been so many advancement in this space, death should not be on the radar at first. It really should be life. And so what we try to do is really echo and trumpet that message, hey, that there is life before, during, and after cancer that we can help out with.
Something that we have discussed before, you did a webinar presentation for us, which was great, but something you mentioned in there was that nearly 1 in 5 cancer cases are tied to weight, diet, physical activity, inactivities, and alcohol. Can you break down for us how excess weight is going to influence cancer risk?
Yes. And again, that differs by cancer type. So we can look at it in a few different categories, as you mentioned. You can look at obesity in a silo and how that contributes to increased risk. And then you can also look at how physical inactivity, diet, and alcohol alone can be risk factors, as well as they can be protective factors, which is the great news that we have a lot of opportunity to reduce our risk. So for obesity specifically, we know that there are 13 cancers linked to higher risk, and that can look a few ways in the body, on a molecular process. But a few of the ways that those contribute is that when you experience obesity, you have higher amounts of fat tissue, and that can increase different hormones that then can contribute to hormone-positive cancers. It can also increase your insulin-like growth factor, and those can contribute to different cancers like colorectal, endometrial, and overall inflammation in the body, as well as it can inhibit some of those other metabolic regulators that can help prevent tumor growth and also can prevent DNA damage, which can lead to cancer. Again, differs by type. For example, if you have uterine cancer, that is a cancer that does increase greatly with your obese and healthy weight status. Or if you look at something like colon and rectal cancer, you're only about a 4 or 5% increased risk. So I like to say all risk matters, but it is differentiating risk.
So if we know that certain factors can help to prevent cancer, shouldn't it be easy to prevent it equally for all people? Well, when you bring upstream factors and social determinants of health into it, it's not quite so simple.
We really have to consider. I know I just talked about obesity in a silo really as the data, but you really can't look at obesity or any other of our chronic diseases in a silo because we have all these other contributing factors, like you said. We can tell people all day to eat whole foods, look for high fiber, dark leafy greens. But if you don't have access to that, if it's not readily available, if you don't have transportation, that's really not great advice. We need to look at those other core barriers in order to increase access to lead to some of these healthy behaviors to reduce cancer risk.
Your systemic issues or challenges where certain groups may be predisposed to having certain kinds of struggles that will preempt them from being able to get the type of care or type of access that's needed to live healthy and well lives.
Cancer incidence tends to be higher in more rural communities. I asked Calvin and Mary why that might be and what are some steps we can take to understand and change it.
So the rural communities unfortunately do face higher, both often cancer incidence and mortality rates. Again, those differ across our communities. Every rural community is different. So we really try to hone in on the specific needs in that community. But a great example is physical activity. Sometimes these rural communities don't have paved pathways or large parks where it's safe and well lit to walk around. So that can be a component. Again, the access to how far you have to drive to get food. And again, those healthy, protective, or reducing risk food categories. Sometimes that's a challenge. Also, general preventative care is a challenge as well. So if you only have a certain amount of providers in your area, and again, who knows how far they may be, you might not be getting your having those preventative conversations with your doctor about maybe your weight status and healthy weight habits, or our cancer screenings. Most people get their screenings through their primary care provider, and so sometimes we just don't know it all, right? We rely on experts. And so when we're not there to see our experts and they let us know when we're due for screenings, that can delay early diagnosis.
By this point in our conversation, I did feel a little overwhelmed about the number of risk factors and the different ways they can be addressed. Calvin had some advice for me.
Add one. Add one fruit, add one vegetable to every meal. It is a very simple way to do it without having a whole lot of personal cost. Because, anytime you talk about food, people are very particular about food and what they eat and how they eat it. So if you want to try something new, I always encourage folks just to add one. That's also include water. When we talk about drinks, folks like the sugary or they like flavor
I know I'm guilty of that.
drink. And so adding one glass to water to every meal helps you to really flush your system as well. So I encourage folks to join the Add One campaign and also add rest.
Yeah, that's one as
Because
well.
because a lot of folks don't get enough of it. And so some of the processing that the body is doing at the cellular level is happening because there is deficiency in water consumption and there's a deficiency of sleep. So Add One campaign is something I encourage anyone to take advantage of.
If I'm in a rural community and maybe the only fruit and vegetables that I have access to is frozen or canned, are those still steps I should be taking?
Oh, absolutely. Frozen is the next best thing to fresh because there's usually not hardly any preservatives that's in the food. But for the can, you can rinse it off to help reduce some of the sodium. Same thing with canned fruit, you can rinse that off. And so some of the processing that's involved. But I think overarching, and Mary, please jump in. But I think the fact that you're developing a new habit, a new behavior towards health is critically important. And so whether it's canned, whether it's frozen, or whether it's fresh, the important thing is that we're adding the things that we need to add to the diet.
I think that makes it a lot more approachable. So, obesity, we've now classified that as a chronic disease. How has our understanding around obesity evolved, and why is that an important shift?
I think our understanding and how we even talk about it has greatly changed over the years. And part of that is because of the introduction of our anti-obesity medications. A lot of people understand those as GLP-1s as they're talked about. And so I think that's brought a lot of positive conversation to obesity, which I think is part of the reason that treating obesity can be difficult is because of the stigma that's attached to it. And so, if there's any stigma or shame, people are less likely to seek care or help, and as a result, even seek some of our cancer screenings. But I would say the largest shift we saw was in 2023. Some of our leading healthcare organizations came together to agree and talk about what obesity is, defining it truly as a chronic disease, meaning that it's not a one time, one solution fix. And so it really needs to be an ongoing conversation, as well as a lot of doctors or other professionals will use body mass index to screen for obesity. So that's BMI. However, that is just a tool to use. It is a not one all be all. We know that's really important that does not replace clinical judgment and that shared decision making with your doctor.
The other thing too, I would just add that when we think about the placement of risk factors, obesity is number two. And it's anticipated the way that it's growing in terms of its impact on cancer. It can overtake tobacco as the number one risk factor for cancer and just chronic health conditions just in general. So I think just the gravity of addressing obesity is important because it poses so many detrimental challenges in the journey of cancer care that we don't want to brush away or overlook.
Do you think this new sort of understanding of obesity as more of a chronic condition, do you think that's brought more awareness to the fact that there are multiple like upstream social determinants of health that are affecting how people become obese, how they struggle to maintain a healthy weight?
Absolutely. I think so. And I think it's brought into the conversation about really looking at a person and their health holistically and how maybe other health conditions might contribute to other chronic diseases like obesity. So I think it's opened the conversation for us to have a greater understanding and then also take a look around us. What is our environment? What's available? And also what does society think? And how can we shift that culture to be overall more positive and healthy?
It's impossible to have a complete discussion around obesity as a risk factor without discussing the stigma that exists towards people who are obese. I asked Mary to talk more about how this stigma is sometimes an obstacle in the way of getting screened for certain types of cancer.
Yeah, cervical cancer screening in Indiana, we are really not where we want to be, meaning that all everyone that is eligible to get screened is not getting screened currently. So, um, all women starting at age 21 should start getting screened, and then we have multiple screening options as we age, both the PAP test and our co-testing with the HPV test. However, do have a lot of studies showing that stigma is a huge portion to treating most chronic diseases. And then specifically when we're looking at obesity, there is an increased risk between obesity and cervical cancer. And I talked a little bit on the biological level, the connection, but actually this is exactly related to what you said with stigma, that folks are just less likely because of stigma, maybe feeling uncomfortable physically with an exam or not unsure if their doctor office has the right equipment that will make them comfortable. So there are a lot of concerns that go along with screening.
Yeah, and cervical cancer, that's something that's pretty preventable, but those screening gaps are still there.
And so when it comes to cervical cancer, I think there's a few gaps. Some people just don't know, right? I think you see a lot of commercials for a lot of things in the world. I don't see too many about getting screened for cervical cancer. So knowing that starting at age 21 through your primary care provider or OBGYN that you can get screened. Uh, and it really is largely preventable. Like you said, we have an HPV vaccine, which we call the cancer prevention vaccine. because it can prevent up to 6 different types of cancers, which is huge. We can't say that for anything else. And it's really underutilized. So starting at age 9, children can get the vaccine, but it is approved for people up to the age of 46. And the great thing when it comes to cervical cancer, we have a really great screening and we have a really great vaccine that prevents over 90% of cervical cancer. So there really is an opportunity to eliminate cervical cancer in our country if we had all the proper tools, all the access in the world to the vaccine and education. But those are the two most important things you could do is get vaccinated and get screened.
When working in rural communities, messaging can be a challenge. I wanted to know if Mary had any particular strategies for working with rural communities when encouraging folks to get cancer screenings.
Yes, I think there's a lot of great strategies we've seen, but I think there's also some untapped opportunity. One of the things I mentioned earlier is some of the strategies is really knowing your community, listening to them. What are their concerns? What do they want to focus on more? And really meeting people where they are. So, if I'm in a rural community and they really want to focus on increasing access to food, then I don't know if I should really be talking about cancer screenings with them at that point. So really understanding what people want and how we can help support them. I think there's a lot of great food as medicine programs is a really great example of that, tapping into our local farmers markets, working through our local community programs like Purdue Extension, and leaning on those experts can be helpful.
Calvin shared that in his experience, who delivers the message is just as important as the message itself.
The messenger is just as important as the message. And so making sure either the physician, a nurse, or someone trusted in the community who's sharing the information is really, really important to really encourage folks to engage in either prevention or early detection strategies such as the HPV vaccination or the cancer screening. So just making sure that, it is someone either from a healthcare background or someone like a faith-based leader or community leader that people really trust, who knows if they say something, it's gold.
But I also think there's a lot of telehealth opportunities, especially on the prevention side. And part of that is reducing some of those access barriers.
Yeah, I am a telehealth podcast. We are a telehealth center, so I love the pivot into telehealth. Let's talk more about that. So, what are some of those opportunities for prevention, for early detection? What do those look like from a telehealth standpoint?
So for looking specifically at telehealth and how we can increase access to our screening and early detection, it can be used to do some initial risk assessments. Are you eligible for screening? Are you considered at increased risk? And those are conversations you can have with your doctor, and they have tools on their end to help calculate that based on your personal medical family history and so on. It can also be really used to help then refer to genetic screening as well. And most of the time, that initial conversation can be done virtually with our telehealth genetic counselors. And again, even though there's a smaller amount of cancer that's hereditary, that's definitely an underutilized a tool for prevention and screening. And then coming down the road, we do have several screenings that are going to be able to be done at home. So currently we have the colorectal screening. We have some stool-based tests. So you could have your conversation with your doctor. If they deem it appropriate for you, they can just mail it straight to you and you can mail it back in. So we're getting a whole screening done without even having visited the doctor.
Telehealth is a tool with many uses. I asked Mary what she thought about the utilization of telehealth in the treatment of obesity and other chronic conditions, and she had this to say.
I think there's absolutely a role for telehealth and obesity treatment. Part of that is because we could have greater access to some of those support professionals. So looking at virtual nutrition counseling to help look at what foods might fit into your normal type of diet. What foods do you like to eat and how those can help reduce your cancer risk. Also, physical activity coaching and some of those. There are a lot of evidence-based weight management programs that can be done virtually. And then also, it's not exactly telehealth, but for the areas that do have broadband access, I know it's not easy to get out during the winter. We can put on YouTube videos, get exercise that way. So there is a lot of way to utilize some of these online platforms. Because obesity usually goes in hand with some of the other chronic disease like diabetes or hypertension, we can also monitor those through telehealth and then hopefully set some more realistic, appropriate goals that are really individualized.
I like that you mentioned not only utilizing like YouTube videos to get active during the winter. I know I've been doing that with yoga, but you also mentioned talking to patients, educating them about the things that they like to eat and making sure that they're not like moving into doom and gloom or just eating bran flakes all the time or whatever. Because we talked about this earlier, but I think when you go from nothing to all with like weight loss strategies, with getting healthy strategies, I think that's an easy way for folks to fail. Thoughts on that at all?
Growing up, I grew up on fatback and ham hocks and collard greens or cabbage. All right. Then it evolved to turkey neck bones because it has less salt, it has less some of the bad stuff. And so sometimes it's just that simple. You don't have to do a drastic change. It is a evolutionary change where it's a substitution. So instead of doing something that's unhealthy, try this. And if you like it, continue. If not, try something else. I think at the end of the day, it's about options. I want to eat healthy, but I want it to taste good. So let's explore ways it can taste good but be healthy at the same time. And so, yeah, we've done things where we trick people. We did a little taste test. We had the food prepared traditionally, and then with the neck bone of a turkey, and then we had it where it was not any meat at all. It was just different hodgepodge of seasoning that they usually like them all. Then once we told them what was in it, it was like, oh wow, aha moment hit, where they said, oh, it can taste. I can't believe it tastes that good. Same thing like with desserts. You don't have to have all the sugar in it. You can substitute it for something else. Still have sweetness, still have flavor, and not compromise the fact you still want that apple pie.
Yes, I think you want to make everything individualized to you and what's going to work for you forever. Like Calvin said, we're trying to build habits, and habits can slowly change, slowly increase in frequency. And so it's important just to take small baby steps, not only because you want it to not feel like a drastic all or nothing, because what's most important is that it's sustainable over time. Because if we're what they call yo-yo dieting and on off increase decrease, that's actually really not great for our heart health either. And so it's more important that we take small slow steps that can last your lifetime.
No, I love that. It's like you grow up thinking you don't like vegetables, and then you realize your parents just didn't season them at all. So, before we move on from telehealth, there is something I wanted to ask about. So, you mentioned earlier, Calvin, about the sort of weight that a diagnosis of cancer can have on someone. And I was wondering if there are telehealth applications with mental health, behavioral health support groups, anything like that, particularly for folks in those more like geographically isolated areas, like rural areas. Is there a way that folks can connect with each other to maybe feel less alone in this?
I will say that there are survivorship groups that do meet using a telemental health platform or telehealth platform that some care providers do provide. And so making sure you touch base with your physician, your nurse, and explore the opportunities to be linked up with that group. I think those groups is really, really important. Social support in the work of cancer care is critically important to health and well-being. And so there are platforms that can be utilized to make sure you join a group to know that you're not alone and that others understand the walk and journey. And it's not just for the survivor, it's also for the caregiver who needs just as much support as the person who's walking through the cancer survivorship process. So, yeah, I believe telehealth, there's platforms. It's just being intentional about making the request and letting your healthcare provider know, hey, I need this support.
And I'll add, I think those type of opportunities are only increasing. I think they did exist before the pandemic, but they have really taken off since. And there's a lot of state and national organizations that will provide that psychological social support through those telehealth platforms.
I wanted to know what ordinary providers could do right now to help their patients get more connected with telehealth when it comes to cancer prevention, screening, and care. Here's what Mary had to say.
I think the number one suggestion is start using telehealth. Some people are more comfortable with it than others. I always like to say, one, it's great to incorporate that into your practice. I'm not the insurance expert on telehealth, I will say, but I do know that those are constantly changing, and we have increased our ability to bill for that recently. It would be good to keep a close eye on that. And that's also an opportunity to educate our lawmakers about how telehealth can help reduce our risks in general. Increase access to these services that can reduce our risk. But some incorporating the services that you do offer in person, like we talked about, that nutrition counseling, genetic counseling, to those telehealth platforms. But I also think it's important we teach people how to use them as well, like patients. It's not the easiest. Sometimes getting on technology cannot be your friend. I think Calvin always says it's great when it works, and when it doesn't, it doesn't. So being able to know how do we actually use these is really great too. But it's a really good avenue to provide that education, that initial outreach with our patients, having those pre-appointment calls to go over some of those prevention, and then also be able to collect information so that when you have time with your doctor, it is really intentional where you need it most with your health.
And I would add, we always say don't knock until you try it. For a lot of providers who may be a little hesitant in trying it, try it in a small dose, pilot it in a specific area and see how it goes. And when you do it, also ask about what your patients think about it. Because at the end of the day, we're trying to do more patient-centered care. And so if they're comfortable, I think it really is inspirational for us to become more comfortable with what they're comfortable with, especially since it's a service of need, not just want. And so that's just something else I wanted to add to the conversation, that sometimes trying new things is just like we talked about with the diet can occur with providers. And so do it in bite-sized steps, do it incrementally so you can get more comfortable with it. I think it's important as well.
You are preaching to the choir here. I always tell folks who are reluctant to try and engage with telehealth or health technology, start small if you need to, but just start. So, if we have listeners today who are concerned about their own cancer risk, what's an actionable step they can take today to start working towards prevention?
I think I'm always going to say number one, HPV vaccine. If you are eligible, if you're between the ages of 9 and 46, talk with your doctor about if that's a good option for you, because that's a great step we can take. I would say our second is to get screens. So we have screenings for breast, cervical, lung, and colorectal cancers. Also talk with your doctor if you're eligible. And then finally, we focused a lot on obesity and cancer risk. So talk with your doctor about your health status and if there are things you can do. So again, I love the campaign that Calvin started, the Just One. Incorporate one more fruit, take one 5-minute walk, start little by little, and just be positive and help make it a community and family adventure.
And the only thing I would add is there is a power in the ask. And don't be afraid to ask questions about what is cancer, what do I do to minimize the risk. Ask your family members about the history of cancer and the lineage. A lot of folks, unfortunately, they do not know because it's not discussed. And so I think, exercising the power of the ask so you can get answers to questions is very important, very valuable, and making sure that the ask is pre-written. So before you even go to a doctor's office or a provider's office, if there's questions that you have about cancer in general or cancer specifically, write it down and don't be afraid to ask either in person, or if you don't like to talk to the provider in person, send it through the chat, email, or a phone call, but make sure you put in the ask so you're not worried about it later or regretting that you didn't make the ask.
Yeah, I like that because I think almost everyone has had someone in their life, even tangentially touched by cancer. And I think it can be scary to make the ask. Like, it's easier not to think about it, particularly if you've had like a family member or loved one who has had cancer at some point. So yeah, I like the idea of just make the ask, just see what you can do, just take the steps. That's good. I like that. So with the amount of AI and like misinformation that exists today, how do patients and community members find reliable nutrition, activity, or cancer prevention resources? Where do I go for those?
That's a great question. I know everyone, it's really easy to play Dr. Internet, which can be really great in some ways, but you know what? It's really hard to decipher, like you said,
Yeah.
what is really great sound, scientific advice. So, one, they could always visit our website at, at the IU Simon Cancer Center, but some other really great organizations. The CDC and the NIH have some really great, easy to read information about a lot of these prevention strategies, but then also just general cancer information. And another great resource is the American Cancer Society. And all of these organizations, including ourselves, have flyers that can help you. What do I ask my doctor? What are the recommendations for exercise? What food has fiber? So we really want to encourage people to utilize these resources. It's not all on you. These are there to help empower you, help you feel comfortable to take the next step or make the ask.
Do you encourage folks to make sure that their provider, that their physician is in the mix when they're like gathering this information?
Absolutely. We always say, talk to your doctor. That's going to be the number one advice we can give, because they're going to be the expert on your health. And then if your specific questions they're not the expert on, they'll be able to connect you with the right person.
Well, thank you both for joining me today and teaching me quite a bit about the steps that anyone can take to lessen their cancer risk. I'm actually thinking about doing that. Add one today, adding a fruit to my lunch later. So
Thank you for joining us for this episode of A Virtual View. A special thanks to both of our guests, Mary Robertson and Calvin Roberson. We look forward to speaking with you again soon.
Thank you for listening to A Virtual View. You can find more information about today's episode in the show notes below. If you would like to support our podcast, please rate and review us on your favorite podcast platform. Do you have any questions or topics you'd like us to discuss? If so, contact us at info@umtrc.org or through the form found in the show notes. Also, we'd like to give a special thanks to our editor, Tristan Yoder. Finally, a special thanks to the Health Resources and Service Administration, also known as HRSA. Our podcast series, A Virtual View, is sponsored in part by HRSA's Telehealth Resource Center program, which is under HRSA's Office of the Administrator and the Office for the Advancement of Telehealth. The content and conclusions of this podcast are those of the UMTRC and should not be construed as the official policy of or the position of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. Thanks for listening and have a great day.